Hello and welcome to our video about how to get rid of yellowish gums. If you've noticed that your gums are turning yellow, you should visit your dentist. Your dentist will be able to clean your teeth more thoroughly than you can do at home. They can also detect underlying problems, which could be causing your yellow teeth. Then, you can take the necessary steps to remedy the situation. Listed below are some things you can do to prevent your gums from becoming discolored. Listed below are some of the most important things you should do to avoid getting yellowish gums. Anemia causes yellowish gums. If you have pale gums, you may have anemia. This condition results from a lack of healthy red blood cells in the blood. This reduces the blood's ability to carry oxygen to all organs, and the weakened blood flow can lead to gum infection. It can also cause the gums to become loose and can cause problems with chewing, speaking, and breathing. People with anemia may experience many other symptoms of anemia, including sensitivity to cold and dizziness. If your gums are pale, you may have anemia. Anemia is a common condition that occurs when your body doesn't produce enough healthy red blood cells. These red blood cells carry oxygen to body tissues and keep them healthy, and they help maintain a healthy body. People with anemia usually have iron deficiency, since iron is needed to make hemoglobin. Because gum tissue needs oxygen, when it doesn't get enough of this vital nutrient, it becomes pale. Enamel erosion causes yellowish gums. There are many reasons why you may have yellowish gums. In many cases, this condition is a result of enamel erosion. Acidic foods are one of the biggest culprits. They break down the surface enamel and cause the teeth to look discolored and dull. Other causes include a dry mouth or decreased saliva production. Some people may also have other medical conditions, such as celiac disease or chronic alcoholism. Enamel erosion is also related to malabsorption problems in the small intestine, which prevents proper tooth development. The first signs of enamel erosion often occur in the dentist's office. The back surfaces of the teeth are the first to be affected. Usually, a light yellow patch will appear on the tooth. This means that the enamel has dissolved, exposing the dentine beneath, which is incredibly sensitive to hot and cold foods. If the erosion is severe enough, it can also cause cavities to form in the main body of the tooth. Poor oral hygiene causes yellowish gums. If you are suffering from yellowish gums, you should first consider whether your dental hygiene is lacking. The presence of plaque and tartar on your teeth can cause discoloration of the gums. These substances cause cavities and damage the enamel of your teeth. In addition, poor oral hygiene can result in gum diseases, which can be serious. Therefore, it is important to maintain good oral hygiene. If you want to improve the color of your gums, watch to learn some of the best ways to improve your oral hygiene. While it's essential to brush your teeth, be careful not to brush your teeth too hard. Brushing too hard may cause deterioration of the enamel and expose the yellow dentin. Therefore, dentists recommend that you use a soft toothbrush. Remember to brush in circular motions and make sure to brush every corner of your teeth. Then, try to avoid eating food that can cause discoloration. To improve your oral hygiene, you should also consider teeth whitening. Sun exposure causes yellowish gums. Gum color can vary greatly depending on your genetics and your daily exposure to sunlight. Generally, gums are pink or reddish in color, but it is possible to have a darker shade of gums. Gums that are dark purple or black are signs of a dental infection. While gums can vary in color, the color is not a problem in most cases. But if you notice that your gums are yellow or purple, you may be at risk for a dental infection. However, it is important to visit the dentist if your gums are changing color. Although the change may seem to be cosmetic, it can be a sign of an infection or gingivitis. This condition is often harmless and easy to treat. The Advance Family Dentists offers a free consultation with a dentist to diagnose your gum color and provide treatment for this condition. You can visit our office in Advance, NC for an examination. Tobacco smoke causes yellowish gums. Smoking can lead to a variety of different issues, including yellowish gums. Smoking can also cause bad breath and stained teeth. As a result, it's important to quit smoking, or at least reduce your tobacco use. Even if you're not at risk for gum disease, it's a good idea to brush your teeth at least twice a day and floss once a day. Tobacco smoke is a major contributor to yellow teeth. Nicotine, the ingredient in tobacco smoke, stains teeth. Nicotine is a yellow pigment because it reacts with oxygen in the air. This causes teeth to appear yellow. Nicotine can also indirectly affect the color of teeth, because it suppresses saliva production. This is why smokers may think that their teeth are yellow. However, it doesn't work this way. Enamel erosion causes plaque buildup. One of the main reasons for yellowish gums and plaque buildup is enamel erosion. Acidic foods and beverages cause enamel erosion. Although saliva neutralizes acid in the mouth, this acid will degrade the enamel over time. Because enamel is not made of living cells, it cannot repair itself. The good news is that there are treatments for this condition. Here are some tips on how to avoid this condition. To start with, understand what is enamel. Enamel is the hard coating that surrounds the crown of every tooth. This layer protects the teeth from acids and foreign materials. When the enamel wears away, the teeth will appear yellow. They may also be prone to chips and cracks. As the enamel erodes, the teeth can become more sensitive to hot and cold temperatures and sweets. This damage to the enamel does not heal, unlike in broken bones. Acidic diets cause enamel erosion. Acidic diets can cause tooth erosion and yellowish gums. According to the British Dental Association, 60% of children show some degree of erosion on their teeth. Tooth erosion occurs when the enamel wears away from the tooth. The affected teeth will begin to discolor and become sensitive. The process is called demineralization, and it is often the cause of tooth decay. To prevent this condition, you should limit the amount of acidic foods and beverages you consume. If you have this condition, you may experience sensitivity to hot or cold foods, as the teeth become eroded. The gums will become sore and may even be painful. In addition, teeth with enamel erosion will be prone to cavities. This condition may also lead to tooth sensitivity. It may also cause the front teeth to appear translucent. If you don't have these symptoms, you should consult with your dentist to determine what the cause of your yellow gums is. Tooth grinding causes enamel erosion. If you notice your teeth turning yellow, this is a sign that you may be wearing away the protective layer of your teeth, known as the enamel. This process can lead to cavities and sensitivity, as well as indentations on the surface of the teeth. Enamel erosion also causes teeth to become softer and more vulnerable to biting and chewing. To make matters worse, enamel erosion can also lead to pain. Teeth grinding is often a result of anxiety or stress. Constant grinding can wear away the enamel on your teeth, and since it is not living tissue, it can never grow back. The best way to prevent this condition is to stop grinding your teeth and to practice good oral hygiene. You can do this by reducing certain foods from your diet and by keeping your mouth clean. You can also reduce your risk by avoiding clenching and grinding during sleep. Enamel erosion causes fungus. The process of enamel erosion results in the breakdown of the outer layer of the teeth, exposing the dentin below. This is a process that can result in discoloration, tooth sensitivity, and tooth cracks. The enamel in the teeth is made up of small crystals which break down much more slowly than the dentin does. As a result, the exposed dentin becomes very weak and becomes easily chipped or cracked. The process also causes gums to appear yellowish and can result in cupped or gapped teeth. Poor dental hygiene is a common cause of enamel erosion. Research shows that almost half of U.S. adults do not brush and floss their teeth regularly. Certain foods, such as starches and sugar, can also cause enamel to erode. Finally, some health problems, such as gastroesophageal reflux disease, can also contribute to the erosion of tooth enamel. The good news is that there are many ways to combat this condition. Thanks for watching. Please like, comment, and subscribe.